This season of Beedie on Eyewear, the podcast, is brought to you in partnership with Orbis UK, a vision charity with a mission to create access to eye care around the world so everyone has a chance to thrive. To find out more or to see how you can get involved, visit orbis.org.uk. Enjoy the show, subscribe so you never miss an episode, and let us know what you think in the comments. So you would say, and I guess some research would also say, that we should be outside, like where to Cardi B.
The next big event was you died.
It's just in everyone's best interest to slow down myopia.
Boom.
No Homo sapiens.
No Homo
No
sapiens.
Homo sapiens. And this episode is not to scare people or say,
No.
oh my God, myopia.
That's one of the things we try to get across to our myopia control families.
Welcome to this episode of Beedie on Eyewear, the podcast for optical professionals and eyewear lovers. I'm your host, Beedie, optometrist, content creator, and spectacle maker. Let's get into today's episode. So, Mr. John Bolger.
That's me.
Welcome to the show.
Thank you.
And as you've explained, you are a doctor, but you're so much of a doctor that you go from doctor back to Mr.
When I passed my final fellowship,
Yes.
the F4CS, I reverted to Mr.
Yes,
as opposed
from
to doctor.
And going, because you are a surgeon, right? And I did my Googles, right? So you specialize, you did cataract surgeries,
Yeah.
refractive surgeries,
Yeah.
other surgeries.
Yeah, I mean, in my career, I've done
A bunch
lots
of
of
stuff.
different surgery.
Yeah.
Because like when I started as a consultant, you had to do everything. You know, you had to do DCRs for blocked tear ducts. You had to do squint surgery for
Yeah.
squint.
But what was your favorite to do?
At that time,
Yeah.
cataract surgery was just about to undergo a revolution.
Okay.
When I started in ophthalmology, cataract surgery was a palliation.
Okay.
You went from blind to half blind, and half blind was better,
Better
than
than
blind.
blind, yeah.
That was before implants.
So were they just taking the lens out and then
You just
leaving
take the
you
lens
plus 12?
out,
That was
yeah.
it. That's crazy.
Stitch it up, run for
Off
cover.
you go.
Yeah.
That's crazy.
And then you
your lenses are
gave
like
the
thick.
patient big, thick
Yeah,
plus 10
plus- yeah,
glasses,
yeah.
and they had to adjust
Navigate.
to the and
So you're doing bilateral all the time then? Because how are you going to...
no. By then, no. You only did in those days. You only did the threshold. The agreed threshold for cataract surgery was when the vision was 618 in the better eye.
Oh, man.
Then you did the worse eye,
Right.
and you gave them their big plus 10s.
Yeah.
So it was literally a palliation.
Yeah.
It was like you were very disabled, and now you're not so disabled.
Now you're not, as opposed to now where it's like,
And
whole new
then
world.
the next big event was you died.
Yeah, well,
So that, and this is true. Not many people know this now. I
did
was
you get
told when I started at ophthalmology as a junior doctor never to use the word cataract in front of a patient,
oh, really?
because for patients at that stage, they all knew someone who'd had a cataract operation,
Right.
and 6 months later
They
was
died.
dead.
Yeah.
Because we just left it so late. And they were so frail, their health was so frail
Yeah, it was
anyway.
just-
So
yeah.
that cataract surgery among the community was seen as sort of your preparation for the next life.
I don't love cataracts, but I think cataract surgery is that girl. It's a great surgery. And you have lots of experience with that. You also have experience with myopia control, which is what we're
Yes.
going to discuss today, right? Now, myopia is very dear to my heart because I am a myope, right? And so I kind of want us to kind of discuss what is myopia, the risks of myopia, myopia control, the methods, and basically just people listening to this will leave knowing more about it, what they can do, all that sort of stuff.
Yep.
So myopia, what is who is she?
Myopia. The word myopia comes from the Greek meaning squinting.
Which is what I do without my glasses.
So without before glasses, if you happen to develop a degree of myopia,
Yeah.
this is how you
Yeah.
would see. But in the last couple of generations, it's exponentially increased in incidence.
Yeah.
And I think we also have to remember that myopia is unsurvivable in the natural world. And so we therefore can assume that our ancestors, like 10,000, 20, 50, 100,000, 200,000 years ago, 1 million, 3 million years ago, were emmetropic.
Yes.
If they were not emmetropic,
If they were going to survive, they would be emmetropic. Yeah.
So myopia
Emetropic being not needing any
not
prescription
needing
at
any
all.
glasses,
Yeah.
having perfect eyesight, distance,
Exactly. Distance,
and
great.
pick up a
The chosen ones.
the way we're supposed to be. Like every
Yeah.
animal, every mouse, rat, bird, they're all
Yeah.
emetropic. Otherwise, they
Die.
or
They get
they're
eaten.
outcompeted by the emetropes for
Yeah.
resources. So myopia was, it just got it kind of grooms its victims, including its the societal aspect of it.
Yeah.
So you don't start off -6. You don't wake up on a Monday having been plano on Sunday and -6. So it kind of
slow and steady.
It slowly gets you, and also it's not that suddenly we're going to have 50% of the whole world population. That's
But
by
it's heading
2050.
there, no? Isn't that the figure?
By 2050, we estimate that 50% of the entire human race will be myopic, right?
Which is crazy.
Which is crazy. And again, that didn't happen instantly.
Overnight, yeah.
We're moving gradually towards it. And it's that slow iteration of change is allowing it to get traction that it really shouldn't have. Myopia is where the eye grows too long.
And why is that a problem?
The optics of the eye are designed to focus the retina at about 23.5 millimeters.
That's the average axial length, right?
The axial length.
Yeah.
So when I see an emetrope, either an adult or a child, a fully grown child, as it
Yes.
were, the axial length is around 23.5. It may be 23.75 or 23.22, and then the other aspects, the cornea and so on, will be slightly different, but it'll lead to an eye that's emetropic.
So when we say axial length, we mean the distance from the front of the eye, the cornea, to the back of the eye, the retina. That distance is really, really important because light is supposed to focus on the retina. If your eye is too long, then the light doesn't focus on your retina. It focuses in front of your retina, and then you get a blur, which is basically me without my glasses.
And myopia is where you're -1, -2, -6, -12, -22, whatever. So your
life
stuck
is here,
is on the end of your nose.
Sucks, yeah. And also the other thing with myopia, because I think that, and we'll get into like the pathology of it, but when it comes to myopia, it's more than just, oh, it's really annoying because I have to wear glasses, or you're wearing glasses, it rains, and now you got water in your lenses, or you got to pay an arm and a leg to thin your lenses down, or you got to wear contact lenses and pay for contact lenses. All those things are inconvenient and are not good things with myopia. But myopia can also be pathological. It can also cause problems that can lead to loss of vision. Yeah. And this episode is not to scare people or say, oh my God, myopia. It's just to kind of make people aware of what to expect, especially people with kids, planning to have kids, ways to kind of hopefully slow down the progression of myopia.
Yep.
So can we get into some of the things that can go wrong when you have a high degree of myopia?
Well, you've got high myopia. And okay, well, the one that is most difficult to deal with because we don't have an effective treatment is macular degeneration.
Yeah, which people associate with age because there is age-related macular degeneration, but can also happen because of myopia.
It also happens with myopia. I think the challenge to it is quite significant because when you look at the pathology, the pathophysiology of it, you get a degenerative change in the photoreceptor layer. Which is probably related to extreme thinning of the choroid. And the choroids, I think there are two very important functions of the choroid. One is to bring nutrients and take away metabolites, but also to control the temperature of the retina.
Okay, what do you mean by temperature?
Well,
like
the retina should be about 37 degrees, like the rest of our body. You go outside into sunlight, you have a 70 diopter lens 23 millimeters away from your macula, right? The amount of heat on the retina will be enormous, right? So that heat needs to be taken away. So the choroid opens up all its blood vessels, which is a lot. And what it's mostly doing is taking away the heat.
Okay.
Now, and that a typical choroid will be 300 or 400 microns in thickness in a 17-year-old with normal eyesight. Now, when you see a myope, one of the first changes we see is thinning of the choroid because they've lived in low levels of light. And they haven't had that exercising of the choroidal vascular response to light.
Right. Okay. I want to get into the risk factors when it comes to myopia.
Yeah.
But before that, so we have myopic macular degeneration. We have retinal detachment. Right?
Yeah.
So people, and if you are short-sighted enough and you've had an eye test, you will hear your optometrist say to you, hey girl, any flashes and floaters, let us know these are not good things. And retinal detachments are not always the end of the world, right?
They're
Sometimes
not,
it's like a cheeky, do you know what I mean? They stick it back on,
Yeah.
everyone's fine. But it can lead to permanent damage to the vision,
Yes.
right?
Yeah.
And then also the need for surgery,
Yep.
which can also lead to cataracts.
Yep.
All roads lead to
All
cataracts.
those things. Yep.
All those things. So
Exactly.
these are reasons why I think myopia control is really important, because we want to
agree.
just avoid
Yeah.
these as much as possible. Now let's get into the fun stuff. Risks of myopia.
Okay.
How do we get here? Why are we becoming more myopic? What's going on?
We moved indoors.
We used to be outside.
We have moved into a level of light that is not natural at all. If you measure the light in a typical indoors school, kitchen, living room, bedroom, it's around between 300 and 400 lux, LUX, which is a measure
Oh my
of
God, I'm getting
incident light.
flashbacks from uni, yeah.
Right?
Yeah.
So, and I would imagine here we're probably in about 1,000 or
because of all
a bit
these
low level. I don't know if we
studio
know.
lights. I have no
right.
clue.
I believe we need to be in a minimum of 1,000 lux.
What is outside?
It's on a bright sunny summer's day in
Yeah.
August, 100,000 lux.
Oh, that's crazy.
It's an enormous difference.
Yeah.
Typically, a dull January
In the
afternoon,
UK,
it might
like
be 2,000
now.
or 3,000, right?
Yeah, okay. But that's
It's
still better
never
than
below
inside.
1,000. It's almost never below 1,000, right? But yet, typically, that's the light level we live in. If you look at schools, kitchens, living rooms, bedrooms.
So we should all be outside.
Yes.
Always.
Well, yes, we should have a more out. My belief is that we're not going to fix this problem. We're not going to find a magic drop or a magic contact lens that means you can live indoors doing indoory stuff.
Being outside is always going to be a net positive.
Yeah, because we've been outside forever, and if you look at in terms of genetics, in terms of
Yeah, I was going to ask about genetics.
in terms of genetics, we haven't had any opportunity to adjust our genes. If there are people who have genes that can live in low levels of light and not develop myopia, it would take maybe 60 to 70,000 years before they would overtake everybody else.
Yeah.
We're talking about 100, 200 years that
Yeah.
we've moved indoors.
Yeah.
If you look at our lifestyle today, it is possible to live exclusively indoors.
Oh, absolutely. I mean, we were saying this, like, you don't even have to go and get groceries anymore. You can literally get everything sent to your house.
Yep.
You don't have to go and do the food shop. Like, you don't have to go and buy anything. You can just get everything.
Exactly.
I mean, when it comes to the genetic side of things vary. And I think I've read papers where they've said, look, no one's really been able so far to isolate the myopia gene, right? Or this particular thing. I've read things where they've said, if you have one parent who's myopic, you're 2 to 3 times more likely to have a kid who's myopic. 2 parents, 5 to 6 times more likely.
Correct.
It varies.
Yeah.
So I guess that is maybe a factor, but then also maybe it's a case of you live with your parents, so you will live the same lifestyle that your parents
Yes.
are living.
Yeah.
And if that lifestyle is inherently inside, then maybe that's what's driving the myopia.
Exactly.
Are there any studies that kind of talk about how light affects the myopia side of things? Because genetics seems a bit like, oh yeah, like maybe not, but light, people seem to be really convinced.
The genetic, just at the genetic aspect, it just doesn't make sense that genes, any gene that caused myopia, it couldn't get through.
It wouldn't survive.
It wouldn't. You
Like
wouldn't
natural
survive.
selection, we're
right?
talking.
It's natural selection would say, sorry mate, you're out.
Off you go.
You're out of the gene
Tiger
pool.
got you.
Yeah, because we all need to see the berries and the wolves and
Yeah, it's true.
etc. Right?
I would not have lived.
Yeah, no,
I'd have been
exactly,
outta here.
Exactly.
Yeah.
I mean, as I say, it's incompatible with survival in the natural world. In terms of the environmental factors, what comes up consistently is the number of hours spent indoors, the number of hours spent in close work.
I was going to say screens. I mean, even reading.
Well, there have been good studies. It is hard to find a good study because many of them are a little bit Me Too-ish. I want to do some research. But there are good studies, and they are consistent in that they tend to find that the relationship between the number of hours spent outdoors protects against myopia.
Okay,
The
even
number
if
of
you have a genetic
hours spent
predisposition.
indoors, and particularly doing close work, promotes the incidence and the progression of myopia.
So if you are doing near work outside, that is better.
Yes.
Okay.
Exactly. And that's one of the things we try to get across to our myopia control families, that it's not the drops, it's not the glasses, it's not the contact lenses. They help. They definitely help. There's no question about it. They're beneficial. But if you really want to arrest the progression of your myopia, you have to adopt a much more outdoor lifestyle.
Yeah.
And when and that's very difficult, because we've just drifted into this indoor notion that indoors warm and cozy, outdoors wet and cold and wet.
Yes.
And of course, that's not the case at all. But that's
unless you're in Manchester.
we need to develop an outdoor like a healthy relationship with that is outside. Habitable in most weathers.
Yeah.
Right? Whereas now we only go outside when it's warm. Whereas really we should be outside all of the time and only come in when we have to.
Like for shelter.
For shelter from rain or cold, extreme cold and so on, which is not most of the time. Most of the time it's capable. We're quite capable.
We need to
be
flip.
Outdoors.
Right now we're doing like 70% inside and 30% outside, and we need to flip.
Well, 30% outside would be good.
Yeah. We're not even doing that.
Well, I mean, the typical. You take the typical 10-year-old who gets up in the morning, flicks the light switch on, the TV screen or whatever, then walks 5 meters to the car. He's now inside the car. Then he gets to the school gate, she gets to the school gate. Then they're inside again.
Yeah.
And then everything is indoors. And then 4 o'clock and it's getting dark, and mum or dad comes, pick them up, and back in the car, back indoors. And so that's just not a natural lifestyle.
Yeah.
And now we can discuss whether that's a good lifestyle or whether, but that when you're a retina, you're going, what am I supposed to do here?
Yeah, your retina.
I'm in 500 of lux. Should I? How do I grow? Do I grow? Do I stop growing? And so on. So we're feeding corrupted data to a beautiful algorithm that has kept us alive and seeing for millions of years. Yeah. I mean, if our ancestors like Homo erectus were myopic, boom.
No Homo sapiens.
No Homo
sapiens.
So we're fooling with this algorithm and feeding it corrupted data, and we're all myopic.
This episode is sponsored by M2M Eyewear, a London-based eyewear brand offering made-to-measure frames for opticians. To find out more, visit m2meyewear.com. Back to the show. So you would say, and I guess some research would also say, that we should be outside, like word to Cardi B, we should be outside. Yep. Okay,
Well, let me tell you just some statistics. You know that the incidence of myopia is much less in Australia than in other countries, because their lifestyle incorporates a lot of outdoor.
Yeah.
Another interesting statistic from Australia is that myopes get less melanoma of the skin.
What?
Because they're indoors more. The myopes in Australia.
I understand what you're saying.
Right? So
then that's why they're myopic, you're suggesting.
They're indoors, so they're out of the light, but they don't get as much
you have to choose
melanoma as
or
those
myopia.
who are emetropic and are outdoors. So that's an interesting.
So let's talk about controlling this myopia, right? Because myopia control is not about curing, as you said before, myopia. Like that isn't possible. If it were, I would be cured. Yeah. But it's about sort of slowing down the progression of myopia. Yeah. It's not to say you won't be myopic, but maybe instead of getting to -6, -10, you are maybe a -3 or something, right?
So that you're in a lower risk group.
Exactly, for all the things we mentioned before. Yeah. So there are different ways. I think the ortho-K, from what I have read and from what we've spoken about, is the most effective form of myopia control. So ortho-K being orthokeratology, which are like RGP lenses, rigid gas permeable lenses that you wear overnight.
Yeah, I mean, the back surface is very different to an ordinary RGP lens.
Okay, yes, so tell me about that. Tell us.
I'm not an expert on ortho-K, and I like to work with optometrists. I leave the correction of the myopia to the optometrists because they're much better at doing it. But I do know that like the back surface of an ortho-K lens is completely different to the back surface of a standard RGP lens, which you would wear during the daytime.
Yeah. Whereas an ortho-K lens you wear to bed, so you sleep with the lenses, right?
With the ortho-K lens, you just wear them at night and you have no glasses during the day.
Yeah, and you take them off in the morning.
It changes the contour of the front surface of the cornea, but also changes the thickness variation of the epithelium.
Okay.
You get thinning in the center and thickening towards just away from the center, and then thinning again in the periphery. So you have a sort of almost a multifocal effect.
Okay, which takes us
And
to...
it's 24/7.
Yeah,
So
yeah, because you take them out and you don't wear them during the day.
You don't wear it.
And
You
then
wake up,
nighttime you
take
put
them
them
out,
back in.
and you put them,
And then what about the soft, because there are soft contact lens options.
There are soft contact lenses. So just before we move away from Ortho-K, we like to have as many children as possible wearing Ortho-K.
Is that your go-to?
That would be our go-to number one. We would recommend Ortho-K contact lenses if
And when you
everything
say
is suitable.
you...
My Eye Clinic.
Yes, I
My
feel
Eye
like
Clinic,
people should know
the
that.
Myopia Control My Eye Clinic.
Mm-hmm.
So we would recommend, if at all possible, if they've got low SIL and they're in less than -6 or whatever, then we say, you're a good candidate for Ortho-K.
Okay.
The children love it. They really do love
Really?
it.
How do they get on with
They just put them, go
I mean,
asleep.
you're asleep, right? So
And they take them out in the morning and they've got normal eyesight all day.
Yeah, okay.
Right? It really is quite intriguing. I mean, given the route I've taken, like putting a child in Ortho-K, I would go, oh my God, that's a terrible thing to do. But actually, it's the best thing
they can be really motivated as well at that age. I know that if I had a kid, I would be like, babe, we're getting these lenses in because we want to save you.
If you give a kid, you're going to live outdoors.
Yeah,
and
I'm gonna move. I'm gonna sell my house and I'm gonna move outside.
Well, see, that's another thing we should be talking about is
living outdoors.
No.
Okay.
How do we modify the built environment?
Yeah.
To where we have easier access to outdoors.
So what does that mean? Would that be like just having like floor to ceiling windows or like having a conservatory or having, would that help?
I mean, I was very lucky. My wife and I, we happened to be able to build our own house.
Oh, nice.
And it's nearly all glass.
Designs.
It's nearly all glass. It's south facing.
Okay.
And we have 2 children who are now late 20s, both emmetropic. I'm a myope. My wife's emmetropic. Yeah.
What's your prescription?
What was my prescription? I'm not going to tell you.
Oh,
it's a secret.
Well, I'm a -450, so I wanted to know if you were the same vibe or you were worse. Oh, you're worse
well,
than that.
I was -450 once.
What? Until you progressed.
yeah. But what I'm trying to get
They're
to
emmetropic.
is neither our children were able to read very early on. We were very proud of our 4-year-olds who could read, and they would read, and they had games, etc. The Nintendos and so on. My son particularly, but my daughter to some extent, she had some games.
Tamagotchi.
So exactly. All that stuff. All that stuff, and that was the way it was back 20 years ago. And but our house. Is very bright,
Okay.
like the
a lot
light,
of natural light.
And the kitchen, we will regularly be about 3,000 or 4,000 lux.
Okay. How are you measuring all this lux? Do you have like a little machine?
I have a lux meter. Yeah.
Screaming.
Now, if you don't have one, don't worry.
Okay.
You can download an app.
What, an app?
There are several apps you can download.
Stop it.
Which can use your phone's light camera to give you a lux reading.
So what are we aiming for? We want to be 1,000 plus.
1,000 plus, minimum of 1,000.
Okay.
If you're in, I believe, I don't have
in my opinion.
In my opinion, anyone who lives consistently above 1,000 will not become myopic.
But then what are we talking? So like for me, it's too late, right? How soon do we need to get this 1,000 lux life going? So
now.
From birth.
From birth. Yeah.
But so for the myopes out there like me, it's all over. Like you can't.
Yeah. The trigger's been pulled and the thing is.
You said so sorry.
Progressing and.
But for the young babes, it's.
Yeah. Okay, to be outdoors in natural daylight, and living our lives in an environment like our house is an example.
Yeah.
Right.
Even though it's indoors, it's still
even
out.
though we're indoors, the lux level is huge.
Huge. Okay.
And for example, on a bright sunny day in July or August, in our kitchen, the lux level will be about 4,000 or 5,000.
Oh, so
indoors,
even if you were reading in there,
so if
or
I was,
you could. I remember you saying when we spoke that if you're going to doom scroll, which we'll do, do it outside.
Do it outside.
At least if you're going to do it, do it outside. Okay, so we've done contact lenses. There are glasses for myopia control too, right?
Okay, there are glasses. There are two that have good data behind them. There's other ones on the market as well, which I hopefully will also produce some good data. But Stellest and from Essilor and Myosmart from Hoya we have many children wearing them,
Yeah.
and they do seem to give good control.
Okay.
Right? They're not on their own. They give good enough control, but you
Okay.
need to add in the
Outside.
outside.
So any
lifestyle.
form of myopia control, if you add outside to it, then now we're talking.
Absolutely,
Okay.
absolutely.
Okay, and what about atropine? Because you guys do atropine at your clinic too,
well,
right?
atropine eye drops. Atropine is a drug. We've been in ophthalmology forever.
Mm-hmm.
Do you know it's also called belladonna?
Belladonna?
Yeah. Which
it
is
called that?
it's belladonna means beautiful woman in
Yeah.
Italian, and it was fashionable many hundreds of years ago that women would put a belladonna in their eyes to make them
make
a
their pupils
beautiful woman,
bigger.
because it was regarded that large pupils were
Yeah.
attractive. I mean, it
So
must have been
stupid.
absolutely incapacitating.
I'm like in summer as well,
So
like,
they-
babe.
Yes,
Sort it
you're
out.
right. But if you were an ugly guy, you were in with a chance. The typical dose in ophthalmology for say for uveitis or something is 1%, but we use a 1/100th of that.
Yeah, you 0.01, 0.05.
or 0.05 or
Yeah.
0.025. Some
Okay.
we only at my eye clinic we only use the 0.01 and the 0.05.
Yeah.
Most of our children are on 0.05.
Okay, are those the ones who are more likely to progress?
They're we kind of have an algorithm that we apply, you know, how myopic are they? And when we say myopic, we don't mean the spectacle prescription.
So I was going to ask you this, because I guess when it comes to myopia, you can track two things: the prescription, -1, -2,
Yeah.
whatever, and also the axial length. I'm assuming that's what you.
The
look at.
axial length is our main one, but also the choroidal vascular index, which is the
Okay.
ratio between the vascular state, the vascular channels of the choroid and the interstitial, the tissue, and also the overall thickness in different parts of the retina.
of the
So
retina,
there's quite a few parameters we look at. And I'll give you an
Sorry,
example. We had
yeah.
one, I remember doing one clinic one afternoon, and I had 3 children, all with about a 25 point something eye. So
What is the average for a child?
for a child who's heading for emetropia,
Yeah.
if you're 10, your
Yeah.
eye would be about 22 millimeters.
Fine, okay.
Right?
Yeah, which is not too far off. Like
It's not
a
too
normal
far.
adult
Yeah,
one.
yeah. So by the time you're an
If you're
adult, it'll be
25 as a child.
23 yeah.
That's crazy.
I mean, crazy.
That's insane.
So we have, so we had, in this clinic, I had 3 children who had 25, let's say they had 25.2 millimeter eye. One was -1,
Yeah,
one was -4.5, and one was -8.
that's crazy. All the same, it was similar
Because
axial
the
length.
other parts of their eye were different. They had steep cornea, flat cornea,
okay.
fat lens, thin
Okay,
lens,
that makes
a
sense.
big deep AC. So the prescription usually doesn't tell you enough of
It's just
what
one part
risk-
of the story.
what risk they're in.
Yeah.
So if
Oh,
you've got a
interesting.
long eye, if you've got a low, you could have somebody who's -3, but they might have a 27 millimeter eye and a wafer thin choroid, and they're at mega high risk.
Yeah.
You could have someone who's -3 with a 22, let's say a 24 millimeter eye with a big fat choroid and really very vascular.
Yeah. So then you're not
choroid.
too worried
And then
about
you're
them.
not too worried about them.
Right, so that would determine what you
So,
do.
so exactly. So it's really distilling down and really
Multifactorial.
looking at the in detail. Where's the high risk and where do you read the riot act?
Yeah.
Which I do sometimes.
It's so interesting. It really is interesting. And I think, okay, so because we're getting to the end now, I would like for you to give us some advice. And I say us, I mean us as optometrists, right? So us as in, you see a patient come in, you're not too sure, they're myopic, things have been progressing. What do we tell patient, parent? And also for parents who maybe just had a kid or have children and think, oh, I'm myopic, they're myopic, or what's going on? What advice would you give us? What are we looking out for? What should we do?
To the optometrist, I mean, to the optometrist, you're the first line of defense or attack. If you
Defense and attack.
if you see a child who's myopic, I feel, and I think even the GOC recommends that you tell the family, this is an environmentally induced disease, and if it's not properly managed, the consequences could be very severe, and that we need to really help you in all the ways that can, you know, with appropriate glasses, contact lenses, advise. Some parents won't want to go on to atropine, but every family should have advice about lifestyle.
Yes.
I really strongly believe that you as a professional group, as optometrists, are ideally placed as the first responders to a myopia scenario, is to say, this is what you need to do.
Lifestyle advice is free, right? Like I can say, oh, hey, I'd recommend Stellis, and now it's like £400 or whatever it is for a pair of glasses, which is not accessible for everybody. But everybody can go on a walk. Everybody can go outside. Everybody can sit in a garden or in a park or wherever and read or whatever.
Or everybody could re-engineer their lifestyle so that they have more time outdoors in natural daylight. Yeah. Because additionally, on a totally separate sphere of investigation, there is very strong scientific evidence showing that people who spend more time outdoors have a greater sense of well-being. They're better at forming relationships. They have far less anxiety and other issues with mental health.
I would agree.
So being outdoors has other benefits.
Yeah, exactly.
And many of the other problems we're seeing in this young age group may well be related to how much time they spend indoors.
Yeah.
So we're going to fix a lot of things by also just getting outdoors.
Yeah.
From the point of view of what do you do in terms of optometry, obviously I would definitely recommend that they have anti-myopia glasses at least. I would say, okay, if they really can't afford it, they should have standard lenses and advice about daylight.
Lifestyle, yeah.
But if they can be encouraged to wear anti-myopia glasses in the form of whatever, Stellis, Myosmart or whatever.
So because I guess and
contact lenses, my side.
This is what I was going to say, but I guess in practice, more time, like say you're on a high street opticians or something, like it's going to probably be glasses. I don't think everybody does ortho-K, or I mean, my site is there, I guess.
I think a lot of optometrists now see myopia control as a sort of subspecialty.
Yeah.
And I think it is where optometry is beautifully placed to be the go-to profession for myopia.
Yeah.
You don't need me, you know. I can
Off you go.
I can flatten the retina. I can flatten the retina or whatever. But really, optometry should be, I would think, it should be looking at saying, okay, we have an environmental disease here. We need to do something about it. I think it'd be very silly if an optometrist thought, oh no, I'm going to lose my living if I cure optometry. There's no way. With 50% of the entire human race due to be myopic by 2050, you guys are going to be flat out no matter what.
And like everyone's living longer, and it's like, say you have a retinal detachment at like 50, you still got another like 30, maybe 40 years to live with this vision impairment. Like it's just in everyone's best interest to slow down myopia.
Exactly.
And if I, back in my day, if when I was 9 and I had to wear glasses, if someone had said, hey, you can chuck these lenses in, I would have wanted to do that. And then maybe I wouldn't be minus 450 now.
And also, if you know, if your parents say, "Well, you got to study hard to get a good job in the future," you say, "No, I don't."
Well, I mean, to be fair, even with that though, jobs are different now, right? Like I mean, having a podcast was never anything I thought I would do when I was in secondary school. Do you know what I mean? Or like, there's so many different types of jobs that exist. I mean, obviously, like study and, do you know what I mean, pass your grades and stuff, but you don't have to kill yourself to. You know.
And then when you look at what children study at school, I just think, what's the point of this?
Of anything.
Why not start school at 1:00? And just do what's important to learn. But
then how would the parents
how many
take
times
them?
have you applied the quadratic equation?
Which one is that again? Is that y equals mx plus c?
I don't. But the point I'm making is, I think a lot of education is just to keep the children occupied. Rather than let them go outside and interact with each other
and play. Nature.
And you learn so much more by playing. Anyway.
And
now, I'm not saying we should burn down schools or whatever.
No, we absolutely should not.
We need to rethink everything we're doing because we're getting it wrong. 50% of the entire planet will be myopic by 2050.
That's insane.
85% of Chinese school leavers are myopic. It's unsustainable.
It is unsustainable. But you know what? I'm glad we've had this conversation because I hope somebody can learn from this, you know? And I would like people to know where they can find you.
Where they can find me?
Where can they find you if they wanted to find you? If you want to be found?
My Eye Clinic, Google My Eye Clinic.
I'll put it in the show notes.
And it's My Eye Clinic as in iPhone. John
no
Bolger,
affiliation.
Bolger, Myopia Control. We're in North London.
Yes. But yeah, if you're still watching, subscribe. I hope you enjoyed this episode. Leave a comment, all the things. And any questions you have, I'm sure John would love to answer them.
I'd love to answer them indeed. Yeah. And I had another lady, a parent of a child, and I went to examine the child. He took his glasses off very carefully and put them on the table, and she sort of picked them up to take care of them. And I examined him, and then he said, "Thank you very much." And he went, and then he couldn't find his glasses.
Panic.
And the mother went, like her face suddenly revealed that now she realized her son is handicapped.
Yeah,
without
exactly.
his
It's a
glasses.
disability.
It's a disability.
It is. It's just one that's catered for.
And it was a moment when I realized that she realized this is no joke.
Look, I've had parents where I will get them to sit in the chair, and I remember this one guy. He was like, I think he was like 14, which is why it was so weird, and he was like -3, and I was like, how is this guy navigating life? Yeah. And his dad didn't believe that his son needed glasses. He was like, oh no, he's fine. And I was like, you sit right here, And I put a +3 in front of him, and I was like, this is what your son can see.
Yeah.
And it took that for him to be like, oh my goodness, like maybe he should. And then when I put the -3 in front of the guy, he can read 6/6 now.
Yeah.
And it's like, I get that it comes across like a weakness.
Yeah.
It's not macho,
Yeah.
but bro, your son can't see.
That's a really good. That's a good.
Yeah, I always do that. I'm like, you look here.
Yeah.
You think I'm lying to you? I just want to sell some glasses. Like, look at what your son can see. So it's kind of crazy, but
You should also have said to the parent, and it's your fault because you're making them study.
You get them inside, you're making them study. It's your fault for wanting them to have a good life. Thank you so much, John. It's been so much fun.
Good.
I'm glad that you found it. Oh, do the picture.
Yeah. Can we stand just
Oh, the light. Sorry.
Behind the light.
I'm so sorry, so sorry.
Otherwise,
you need the light.